Hi and welcome. My name is Rebecca Bowden and I am the course lead and lecturer in children's nursing here at Staffordshire University.
Hello, my name's Lorraine Vine. I'm a new lecturer to the children's nursing team here at Staffordshire University. I've been here for 6 months.
Okay Lorraine, so I know that you've been doing lots of teaching with our students. What sort of things have you been enjoying?
I have enjoyed the face-to-face teaching. A lot of our learning's been online at the moment and that's great and there is interaction that way, but I've really enjoyed actually getting into the skills labs with the students to do some one-to-one, some face-to-face work with them and some more practical skills.
Okay.
But what I've been aware of is that whilst I've been able to do some of those practical skills, I haven't really had a go at working with the mannequins that we have available to us today. I wonder if you could maybe talk me through some of those?
Of course, yeah. So let's have you met Sam before then?
I haven't. I've seen him from afar, but hello Sam, my name's Lorraine. I'm going to be your nurse today.
So Sam is one of our Sim Junior mannequins and he is roughly about 7 or 8 years old. So
Okay.
why don't we do some observations on Sam?
Okay, that's great.
So if you'd like to, you could feel a pulse on Sam.
Okay, so I'm sure a lot of you are already aware to feel your pulse you might be put 2 fingers on your wrist here. That's called our radial pulse and you'll be able to feel it beating. So that's what I'm going to do with Sam just at the moment. Okay, I can feel his pulse beating. Other areas we can test a child's pulse are here, the back of your elbows, and also here on our neck. That's our carotid pulse. So I can feel his brachial pulse, the back of his elbow, and I can also feel his carotid pulse on his neck. And then all the observations will appear on the screen to the left of Sam at the moment.
Wonderful. So another thing that we can do with Sam is we can measure his blood pressure. Lorraine, would you like to measure Sam's blood pressure using the piece of machinery you've got there?
Okay, we've got a blood pressure machine here called a Dynamap. Sam, I'm just going to take your blood pressure. So we'd lift Sam's sleeve up, wrap the blood pressure cuff around his arm. Okay, Sam, it might squeeze a bit, okay, but it's all right, it won't take very long and it might make a bit of a noise. Press the button and that should inflate. Okay, Sam, it'll be done in a second. That's then complete, and again the results will pop up on the screen to the left. Thank you. I'll just take this cuff off of you now, Sam. Thank you very much.
Okay, so we could also measure Sam's oxygen saturations if you'd like.
Thank you very much. So this is a little piece of equipment that's going to measure Sam's oxygen levels. And I'm going to turn that on and pop it on his finger here. And that will tell me whether or not his oxygen levels are right for him. And they're fine.
Thank you. And then finally, just for now, I'd like to do Sam's temperature.
Okay.
There's some probes there.
Thank you. Sorry. A lot of you will have had these temperatures done on yourselves. I know I've got one of these at home for me as well at the moment. So I'm going to turn it on and I'm going to pop this in Sam's ear. Sam, I'm just going to take your temperature, okay? Just going to see how warm you are. Won't take long. Okay, that's beeped and that's come up that Sam's temperature is normal, so that's good.
Lovely, thank you. So to complete our observations of Sam, we would then document Sam's vital signs on his PEWS chart, his Paediatric Early Warning Score chart.
So that's his observation chart that would be on the end of his bed, so I'll complete all of that down. And then that gives us a record for us to check and monitor whether Sam is stable or whether he's deteriorating and becoming more poorly. I've done that.
Thank you.
Put there. Thanks Sam, that's fantastic.
So the way that we would use a mannequin such as Sam is that we'd probably have a theory session first where we'd understand perhaps some of the anatomy and physiology. We'd look at what the normal parameters for the vital signs are. We'd understand why those vital signs were important to measure. And we'd talk through the process and we'd perhaps use some videos to really show how to take those vital signs. We'd then come into a skills lab like here, like we are now, and our students would have the opportunity of practicing those skills with Sam at the bedside, but just focusing on the skill aspect. So we do that for a number of different things. Obviously today we're looking at vital signs and observations, but we might do that for things like medicines administration, injection technique, catheterisation, and so on.
And those have been my experiences so far, Becky, when I've been supporting students to learn how to give injections and to catheterise somebody. And it's been really great to see that they've actually come in with a bit of knowledge because they've watched the videos, they've had the theory sessions, they come in, they get a quick overview of how it should be done, and then they're allowed to play and actually try and sort of hone that skill, but in an environment that's safe and they're not going to do any harm to anybody.
Absolutely. We hope you found our simulation interesting today. Thank you, Sam, for participating. Thank you, Lorraine, for demonstrating, and thank you everyone for taking the time to watch this. We hope you found it interesting, and we would love to see you at one of our on-campus events, one of our open days or school and colleges events very soon. If you do require any further information, please get in touch. You can also find more details on our Children's Nursing at Staffordshire University webpage. Thanks again, and I'll see you soon.
Bye.